I'm Srividya Vasu, postdoctoral fellow in Islet Cell Lab at Baylor University Medical Center, Dallas. I'm going to present our research on association of circulating microRNAs with patient, disease, and islet isolation characteristics, results from a multi-center study of total pancreatectomy with islet autotransplantation. TPIAT procedure is performed to alleviate symptoms associated with chronic pancreatitis and recurrent acute pancreatitis. There is a need for simple biomarkers to assess disease progression, determine timing of surgery, and predict islet isolation outcomes to improve post procedural functional measures. In an earlier single center study at Dallas, we identified circulating microRNAs associated with CP or islet damage. The main objective of our study was to study associations between circulating microRNA signatures and clinical measures of disease progression and islet autotransplantation outcomes using data from POST. We have formed a multi-center consortium of 9 institutions and a data coordinating center to address research gaps in TPIAT. For the study, we recruited participants scheduled for TPIAT. Their demographics are listed here. The plasma samples collected at each center were sent to Bumsey at Dallas for microRNA measurements. All clinical and microRNA data were consolidated and analyzed at University of Minnesota School of Public Health Data Coordinating Center. The circulating microRNAs pursued in the study are listed here. We observed that adult age in comparison to pediatric population was associated with higher levels of 148A3P, 200C3P, and 221-3P. We also observed a linear association of BMI with 148A3P. And also, genetic and toxic risk factors had different microRNA profiles. And also in patients with exocrine insufficiency, we observed a significantly reduced circulating microRNA levels, warranting further investigations. Preoperative fasting C peptide levels also associated with 29p3p, 148a3p, 320d, and 221-3p. I would like to emphasize the microRNA association with the bulk of the data with C peptide levels between 0 and 5. We also observed that um, total islet yield was associated with 29p3p inversely. Tissue volume was also associated with 200C3P and 221-3P significantly. So overall, microRNA patterns observed with pancreatic exocrine insufficiency, preoperative metabolic measures, and islet isolation outcomes. Further studies will focus on predictive potential of the circulating microRNAs regarding islet mass yield and metabolic and clinical outcomes. The table here lists the direct or inverse associations and or increased or decreased levels of the circulating microRNAs in respective tabs. I would like to acknowledge our collaborators and coordinators at the participating centers. The project was funded by NIDDK R01 grant to Dr. Belen. Thank you.